lead to serious problems. And just to inform you that there are certain familial tendencies to have these types of abnormal blood clots floating about. Some of them can appear in your legs. Let us say if the person has been traveling, sitting for long periods, the blood clots can form. Some form in the lungs. And so, of course, we also know about the ones that form in the brain, like the one that cause strokes, which block blood vessels and brain, and the brain fails to get blood supply. So there is a familial tendency in certain people, but also certain medication can contribute to this. One of them is artificial contraceptives can have this effect on certain people, not all of them. Women of African origin do tend to have the blood clots as a result of using artificial contraceptives of certain types. Then one of the things that has caused an increase in blood clot issues is COVID. In the COVID pandemic that we had has left a greater tendency for this. And also people who smoke can increase their tendency to have this abnormal blood clotting. So apart from that, maybe some of the lifestyle points that can help us would be to increase movement and exercise in one's lifestyle. And even if you're traveling, for example, you may be, let us say you have a long flight or a long drive, then if you're not able to get up from time to time and improve your circulation, you can use compression stockings if you have, you tend to have issues of this type. Or you can keep on wiggling your feet and your legs as you are seated and try to not remain in the same position for a long time so that the blood is not constricted in a small area for too long. Then we also encourage that we cultivate the habit of healthy eating, so a healthy heart diet that excludes seed oils, junk food, and so on. And as I said before, include movement and regular exercise in your daily routine. Particularly if people in your family have already had this issue, then take those precautions. But of course, once the blood clot has formed and the situation is there, you need medical attention so that you get medicines that are going to break up the clots. And also, you may need some serious interventions if, for example, the clots are many and appear in an organ like the lung. So this is quite a serious situation. And our help will be more as prevention if you have a familial tendency, or how to deal with the situation once the medical intervention has taken place. We recommend that if you are on blood thinners, do not use a product like omega-3 plus without the knowledge of your medical practitioner, because it also thins blood, so that your blood might become too thin. The same applies to vitamin E. But there are other supplements like lipotropic adjunct that you can take, garlic allium complex, as well as magnesium complex. But for a precaution, of course, we can include omega-3 plus if you're not, you just simply want to be careful because you have a familial tendency. Then the next question was, again, another fairly common one about what to recommend for ulcers. In this case, it was stomach ulcers. So ulcers in the gut can be due to various things or habits that inflame the gut. And when the gut is inflamed, we have a tendency to be infected by what is called opportunistic bacteria, which normally will still be in your gut. But if your gut is healthy and you have got a good gut microbes, then their numbers are always kept in control. But if maybe as a result of prolonged issues of the gut, you have developed ulcers, then the H. pylori can make things worse. So the H. pylori normally will be controlled by your systems. But if you have this inflammatory and problematic foods and things like that, then you may find that the H. pylori can increase and worsen the damage to your gut, leading to ulcers. And remember that ulcers are not a minor issue. They can actually bleed and endanger your life. So if you have ulcer problems, I highly recommend that when you use the toilet for a long call, take a look to see if there is any blood in your stools, because that could warn you that your ulcers have started bleeding. Certain over-the-counter pain medications that people use can be dangerous if you are taking them for prolonged periods, especially on an empty stomach, that you're maybe in pain and maybe you don't have an appetite and you simply take the medication. If you're going to take pain medication, it's important, unless your doctor says otherwise, to have some food in your stomach so that the stomach lining is protected. Smoking as well as alcohol use can contribute to the damage to your gut, which is the first step towards getting ulcers. So one also thing I want to mention here is that when you start having these issues of ulcers, do see your doctor, because you may need to be given antibiotics to kill the H. pylori so that the population decreases in your gut. And that can be an important first step towards healing your ulcers. Again, as I've said, avoid taking pain medication on an empty stomach, and also resolve stressors. Stress does tend to worsen ulcers and gut issues. And a thing that has been mentioned by people who have experienced relief is the use of raw cabbage juice. So you simply take cabbage leaves and you maybe pass them through a juicer, and that juice actually can soothe the gut and relieve pain, at least temporarily, as you are trying to resolve the issue. The supplements that are going to help with the healing of the ulcers will be chelated zinc. Also, garlic allium complex keeps the population of H. pylori down. And aloe vera plus is going to be soothing to your gut. And also you can add there vitamin C or flavonoid complex. So those are the supplements that we recommend, together with some lifestyle points, as well as the use of raw cabbage juice to help you to get some temporary relief if the pain is very bad. The next question we had was of a condition known as eclampsia. Also, it can be referred to as preeclampsia. So this is a thing that happens to pregnant women, and they may suddenly have convulsions as well as a rapid increase in their blood pressure, thereby endangering the life of both the mother and the child. So eclampsia and preeclampsia are quite serious, and they also do tend to run in families. So it's good if you are maybe planning to have a child, or you are pregnant, to find out from your mom or the women folk in your family if they had issues with sudden increases in blood pressure when they fell pregnant, especially the mid to late part of pregnancy, and if there is any history of eclampsia. The first thing I recommend for this, if you have a familial tendency, is to mention it to your obstetrician so that they are aware, and thereby keep a keen watch on your blood pressure and other markers that might indicate that there is a possibility of this. Then opt for healthy food choices and avoid junk food that can contribute to blood pressure issues. And so it means monitoring your blood pressure regularly. There's gadgets that you can buy nowadays that can help you to keep an eye on your blood pressure so that you are aware if it's rising to a dangerous degree. Then resolve if you are already a person who has high blood pressure and you are pregnant or planning to start a family or to have another child, then do what is needed to resolve your high blood pressure issues as soon as possible. So we have the supplements that we normally recommend for healthy blood and cardiovascular health. Those should be part of your supplementation, together with a healthy heart lifestyle. Then we have the supplements that we recommend will be CalMag. We also recommend omega-3 plus and vitamin B complex. You can also add their magnesium complex. So CalMag, or in addition to CalMag, you can also have magnesium. In addition, omega-3 plus and vitamin B complex. Usually, we already recommend this for prenatal supplementation together with a few others, but they are already a component of our recommendation for expectant moms because they help with their precaution that can help, at least so that it gives you enough time to get medical attention if you go into eclampsia or you show signs of preeclampsia. Then another question was prolonged. Okay, there were two questions. I'm not sure if they are from different people. Prolonged upper respiratory tract problems or inflammation, and also chronic pharyngitis, which means more or less the same thing. So this person or persons have been struggling with infections of their throat and the upper air system. And here we can say that it could be due to allergens. So you may be allergic to things which make you cough. And as long as they continue to be present in your environment, you can keep on having coughs and coughs and coughs. And remember, coughing for long periods can actually lead to things like backache and chest ache and so on. Also, if it's not allergens, it can also be a recurrent infection, and that can indicate that maybe your system is not as robust as it should be. So where possible, do try to identify and avoid triggers like allergens, and get enough sun exposure. Getting the sun and the vitamin D that we are able to make as a result is very good for respiratory issues. Then the supplements that we recommend that will help you will be omega-3 plus to deal with the inflammation from in the pharynges, that is the upper breathing tubes. Another one will be flavonoid complex, which also contains some vitamin C. We also recommend chelated zinc to heal the rawness of the pharynx. And then we recommend herbal respiratory complex, which is a herbal preparation that helps us with issues to do with our breathing system. Unfortunately, herbal respiratory complex is not in all regions. If you have it in your region, then you can use it. I think that might also help is using all C to suck, especially when one is having that irritation of the throat. Another question was what to recommend for dyslexia. So dyslexia refers to difficulties in reading. It's an unfortunate condition in which people often who are not so aware of it, may conclude that the child or the adult is simply illiterate or stupid, but it's actually because the brain processes letters and words in a different way from the majority of the population. So dyslexia does not show low intellect. It's simply that your brain works differently in conveying the letters and words that you see on the page to your brain. And that makes it difficult to decipher the words that you are seeing in front of you. So one of the things that can help with this is to practice reading aloud for several brief sessions daily. So it should not be prolonged sessions. So for example, if it is your child, or if you're a young adult who is struggling with dyslexia, maybe a high school student or something, then create situations where you read aloud for short periods, just a few minutes. When you begin to get tired, you take a break, and then at another time, once again, you do it, because this type of practice does help the brain to become more adept at deciphering the words. Another thing that can help is to use audio as well as sight. So for example, as you are reading aloud, there can be a device that helps you with the words, so that not only are you hearing, you are also seeing. and this helps you to get the reading done more easily. The supplements we'll recommend here will be mind enhancement formula, omega-3 plus, and magnesium complex. But remember that practice is going to be important. And just to say that you may not be a person who finds reading easy, but these days we are fortunate because quite a number of reading material is also available in audio, and you can look at where you can get books that you can listen to rather than read. Or you can record lessons with the permission of your school or your teacher so that you can listen as well as read, especially if you're struggling and maybe you need to prepare for exams or something like that. So that is the ideas we have on dyslexia. Then another person wanted to know what to recommend for having chronic high blood volume, even when they do periodically donate blood. So this might simply mean that they have got a lot of fluid in the volume of fluid in their system is higher than it should be, but it can indicate an underlying conditions. And so my first recommendation would be to work with your doctor to investigate if there is any issue to do with the efficiency of the heartbeat, or if the kidneys are maybe not functioning as well as they should. If that has already been done, which is probably the case, then the supplements we'll recommend will be multimineral plus. We recommend vitamin B complex, and we recommend omega-3 plus. And of course, you can consult with having regular blood donations to help you to keep your blood volume under control to the degree that it is possible. Then another question was what to recommend for insomnia or difficulties to do with sleep. Remember, we have said on previous occasions that we need a minimum of 7 hours of sleep every night. Some of that sleep should be deep sleep, because it is during deep sleep that our body does essential work such as cleaning up the brain, because that is when the brain is almost inactive as possible. The brain is never completely inactive, but in deep sleep, it is low inactivity. And that is when the body takes advantage to clean it and to do other maintenance work in the body's systems. So if you're not getting enough sleep and good quality sleep, then you can have other serious health issues, which includes incidentally things like weight gain, things like mood issues and energy issues, and so on. So we recommend some lifestyle points. Cultivate the habit of going to bed at the same time every day. I know that this can be frustrating if you go to bed and you're just thrashing around, tossing and turning and not going to sleep, but it is a way to train your body to learn to come to rest and to get to sleep. Then another thing is to avoid the use of screens and stimulants near bedtime. So from at least 2 hours before your bedtime, avoid using screens, because the blue light in screens can interfere with sleep in some people. Also, stimulants like coffee and alcohol and so on take long to be metabolized, and they can interfere with the quality and quantity of your sleep. Then be active during the day in order to increase the need for rest and sleep at night. If you have a sedentary job, then see how you can incorporate movement and energy-using activities to make your body aware that it is tired and it is in need of rest. And that can also assist in improving insomnia. Then the supplements that we recommend will be magnesium complex, which is very good for helping you to relax and also helping you to fall back asleep when you wake up. And here I just want to mention that our sleep is, for most people, the sleep is not one continuous blank. We sleep in cycles, from which we start one cycle. When it ends, we might get a little bit wakeful, then we go on to sleep again and start the next cycle and so on. And in that 7-hour cycle, we can have between 3 and 4 cycles. So if in the middle of the night you find that you've woken up, don't immediately start getting up and doing things that are going to make you more wakeful. Rather try to stay calm and asleep and lying down so that the next cycle of sleep is not interfered with. So magnesium complex helps you with that, to keep on being relaxed, even when you find yourself awake in the night, so that you can get into the next cycle of your sleep. Aloe Vera Plus, another one, very helpful, because if you have issues like gut issues, they can interfere with the quality of your sleep, and aloe vera helps with that, as well as with stress. Then vitamin B complex is another one that will also be useful in improving the quality of your sleep, and also giving you energy during the day so that you are active in the daytime. Spending time in daylight helps your body to follow what is called the circadian rhythm, so that, remember, we evolved to live outside in an outside environment for the majority of the day. And that being out in the light helps our brains to follow the cycle of being awake during the day and being asleep during the night. So those are the supplements and some of the lifestyle points that you can look at to see if they can help you to improve your sleep. Another question, someone wanted to know which of our supplements contain thiamine, and thiamine is one of the B vitamins. So to get thiamine, you can get vitamin B complex. And remember that these types of vitamins that occur as a family, of which B is one of them, work well together. So they work better as a team. They support each other's activities. So B complex contains thiamine, for the person who wanted to know which supplement has it. And next question was what to recommend for cancer. There were different types of cancer: throat cancer, colon cancer. And our supplements for cancer will be Phytodefense, our phytonutrient supplements. And if the person already has cancer, we recommend that you increase your dose, particularly with something like throat cancer, where your ability to eat healthy food might be impaired. Then Phytodefense can give you that extra nutrition that is crucial. We recommend as well omega-3 plus to deal with inflammation that comes as a result of this illness. And if you need a boost in your protein nutrition, then add Neolife Shake, especially if maybe you are trying to maintain a healthier weight because you've lost too much weight, excuse me, or if your appetite is poor, or if you are vomiting a lot. Then I find the Neolife Shake is very useful as a good and easy source of high quality protein, so that your body can use that in tissue repair. Then another question was what to recommend for schizophrenia. So schizophrenia is a mental illness, and it may appear late in life or sometimes even earlier, but it appears maybe from adolescence and onwards. It is important to try to eat a healthy diet, because there are certain junk food and such types of things always worsen illnesses to do with the brain. Then we recommend that you remove grains, because they don't help things, especially refined grains and sugar. You can replace the grains with minimally processed fiber-rich carbohydrates, things like arrowroots, things like cassava, sweet potatoes, and so on. Also as well, fruits and vegetables, leafy greens, and so on. All these will be healthy and can be used to replace refined grains. And then we make sure that the diet contains enough proteins, things like fish and eggs, meat, avocados, and so on, should be plenty in the diet. And then eliminate seed oils from the food, because they they worsen inflammation in the system, and this does not improve the issue that you're dealing with. Opt rather for healthier fats that will be found in nuts, will be found in things like avocado oil, which you can use for cooking, things like ghee, things like coconuts, olive oil, and so on. Then the supplements that will assist here will be omega-3 plus, vitamin A plus D or good sun exposure, then vitamin B complex, and vitamin E. So those are what we would recommend for schizophrenia. It may, of course, reach a stage where you need to have the person, you need help to take care of the person. And of course, that is a very difficult decision to have to make. It might be important for the family to have a discussion and be aware of the difficulties that can result, and that it may be necessary to make some of those decisions together. Then another question I had here was what to recommend for an obese infant or a child, so a small child. And of course, childhood obesity is becoming a serious problem in our society today, including here in Africa. And this is mainly to do with the food choices that we now have. And we are finding it easy to start our children on very problematic foods at a very early age. So I would very much recommend that parents in general reconsider introducing packaged foods and sweetened drinks and all these types of foods to their children at an early age. The babies should not be given these very sweetened types of baby food that we find in our shops. And also to say there is no supplement that we have that is going to specifically cause weight loss in a child or even in an adult. If there is no underlying health issue, the only way to help the child is to drastically change their diet. And that means removing these types of foods that we often see as something that makes our children happy, because if we give them a sweet or a biscuit or a soda, they are happy and they drink it very cheerfully. But those are learned habits. Remember that mankind lived for many, many, many years without taking almost no sugar, because most sugary things had very small amounts of sugar and they were very difficult to get. The reason why our children are now struggling with this is because we have embraced all the manufactured foods that have been introduced from Western countries. And the thing is, Western countries are well developed and able to take care of their people in the long term. Most of our countries here in Africa are not able to do this. If our children start being obese in childhood, we are consigning them to a lifetime of great health difficulties. So rather than introduce your child to these packaged and refined foods, breastfeed them for as long as you can, let us say at least 18 months and up to 3 years, if possible. And then introduce them to normal family food. Like if we are having ugali or pap with vegetables and beef stew, then feed them little by little of that. You can mash fruit and give them. So wean your children with the normal food that we know about that is recognizable. And it may not be as fancy as what the advertisement is telling you, but you will help your child to cultivate a taste for real food that is nourishing and good for them. And if later they start having unhealthy habits, because I know I'm a parent myself and strive to do all this only to see my children as young adults being so excited about regularly drinking sodas and eating fast food and all that, but they already had a taste for healthier foods. And when they started seeing maybe they are gaining weight, especially around the belly, they know what to do, and it will not be as difficult as if they are completely unused to eating those foods. So eliminate all sugar, all wheat, all packaged food, junk food, things like French fries and so on. Eliminate those and introduce the child. Simply stop buying them and stop cooking them. This is an infant. The only way they'll get that food is if you provide it. Then make sure that the snacks you give them are healthy. It could be things like fruits. Here in our continent, there are lots of healthy fruits that are quite affordable. Opt for those as their snacks. Give them things like milk or water to drink. These are very good drinks, and especially if the child does not react badly to milk. But water is good for everyone. And then encourage the child to play outside and get plenty of vitamin D as well as exercise. And the supplements that we recommend are not specifically to make the child lose weight, is to ensure that as the child is learning these new food habits, they are getting nutrition. And so we'll be recommending here Vita Squares, which are also nicely flavored, VitaGuard and Neolife Shake. So this will supplement the food. Maybe they will not be eating as much as they need to because they don't like the change you have put in their diet. But these will be nice things to take, which are also nutritional supplements. The Neolife Shake that you give them should be mixed either with water or possibly with milk and with no sugar added, so that you wean the little one of the habit of always seeking sweet things, because this is a big struggle. Remember, I mentioned before when we were talking about the liver, sugar is the alcohol for children. To the liver, sugar and alcohol are the same thing. And the damage it does to the liver, the two things do to the liver is the same. So help your child to kick the sugar habit or to never start it at all until they are older, when they are making their own choices where you cannot control them. At least you'll have done your part and they will not have a difficult time opting for those healthier choices, because they were there in their growing up years, and if they come into difficulties, they can go back to them. So I see that I have taken quite a bit of the time to answer some of the questions. I think we have made a good progress with them, but I want to thank you very much for having sent your question. It's always a pleasure to hear from your side. And I hope that if we did not get to your question today, I know there are a few that are left, you will not be discouraged and you will keep on sending these questions. As I've said before, if you have an urgent question that you want to be answered directly, you can then message me directly, and I always try to give you a response within a day or two. So I wish you the best in this new month of August. I hope that you have already set your goals and you'll be able to reach those goals as we go about our business of making the world a healthier, happier, and wealthier place. So here is Pascal now standing by to take you through the second half of today's session. Good night.
Thank you very much, Betty. Today I want to discuss with you something that I find very, very important